The third part of drug interaction, that is known as the distribution interaction. Absorption, distribution, metabolism, and elimination. Interaction where the distribution pattern of the object is altered. Altered means change. Major mechanism in the alteration in protein binding taken place. Protein drug binding will be there. Example: competitive displacement interaction. Displacement means what? First drug will be displaced and other drug will be take the place of first drug, that is by the another drug, that is known as the displacer. Anticoagulants like warfarins are displaced by the other drug known as the phenylbutazone and salicylates. They are the anti-inflammatory drugs. And influence or interaction, they are known as increased clotting time, produces the hence increased risk of hemorrhage, means blood can be lost from the your body part, that is known as hemorrhage. Second example, tolbutamide is displaced by the sulfonamides. Both drugs are given for your hypoglycemic effect, means both drug will be same action of hypoglycemia and they will produce the increased hypoglycemic effect will be produced, that is distribution interaction, means more amount of drug will be bind with your protein binding is more, means what? Excretion will be less. Metabolism interaction. So this interaction where the metabolism of the drug is altered by the two methods or two ways. First, enzyme induction. Induction means what? Increase the rate of metabolism, like catalyst action will be there. And second, enzyme inhibition. Inhibition means to stop the action of your enzyme, that is known as the inhibition. That will directly lead to the decrease the rate of metabolism. That is object drug, precipitant drug, and influence. Influence means drug interaction. Enzyme induction, first part: corticosteroids, oral contraceptives, and phenytoin. It is precipitated by the drug known as barbiturates. That will lead to the decreased amount of plasma level, decreased efficacy of object drug, means effect of the corticosteroid, oral contraceptives, and phenytoin has been drastically reduced. So that is the known as enzyme induction. Second, oral contraceptives, hypoglycemics, and coumarins is precipitated by the drug rifampicin. That will produce the decreased plasma level. Here both influence we are showing the decreased plasma levels. Why the plasma level has been decreased? Because enzyme induction will be more. If catalyst action is produced, the metabolism of the drug will be fast. So metabolism, corticosteroid, oral contraceptives, phenytoins, hypoglycemic, and coumarins, what will it do? Enzyme metabolism will increase, so that's why amount of plasma drug is reduced, and it is fast metabolized and fast excrete will be there, means action of the drug will be reduced. Then tyramine rich food is inhibited by the certain drugs. In the first table we have seen about the enzyme induction. Enzyme induction means catalytic action of your enzyme. Enzyme action will be increased. Second part is the enzyme inhibition, means enzyme action will be reduced or slowed down. That is example, tyramine rich food is the MAO inhibitors, means monoamino oxidase inhibitors, that will reduce. Example is enhanced absorption of unmetabolized tyramine, means what will happen? Unmetabolized tyramine, which is metabolism is not done by the enzyme of tyramine, so that's why enhanced absorption of metabolism. So that will what? The example is enzyme inhibition, means metabolism is drastically reduced. Second example, alcohol is mixed with the disulfiram and metronidazole and tinidazole. It will influences increased plasma aldehyde level. It is very famous example. Alcohol and disulfiram, what will happen? Increase the amount of aldehyde into the blood, so that's why uneasiness, nausea, and vomiting like Symptoms are produced due to the presence of aldehyde due to the blood or your plasma. So that's why sometimes it may be used, disulfiram is used to uh, take the away alcohol. So that's alcohol we cannot consume if you are going to take the drugs like disulfiram. So that is anti-alcoholic drugs, we can say the disulfiram was there. That is the enzyme inhibition, metabolism was not taken place and our body become the nausea, vomiting symptoms are there. Irritating effect are produced into the body. Excretion, interaction. Excretion, how much amount of excrete of the drug, that is the excretion. Interactions, interaction that result in change of the excretion pattern of the drug. That is first major mechanism of action, that is one is the alteration in the renal blood flow, how much blood flow to the renal, that is alteration. Second, alteration of urine pH, urine pH will be changed, acidic, basic, that pH will be changed. Competition for active secretion, how much amount of secretion of drug taken place, that is the competition will be there. And then forced diuresis, if certain drugs we are taken, they will produce forced diuresis and blood volume will be reduced, that is the forced diuresis. These are the types of your excretion interactions. Example are known as object drug, precipitant drug, and its influence, means what will be the symptoms. First example, penicillin, cephalosporin, nalidixic acid in combination with the propenicid, they will produce the elevated plasma levels of acid, risk of toxic reaction, means elevated levels drugs are taken, so that's why amount of blood, amount of drug is taken into the plasma, so that will produce the risk of toxicity, means what, excretion is not taken properly. Second example, acetohexamide is mixed with the phenylbutazone, they will produce the increased hypoglycemic effect. Then changes into the urine pH, they are known as amphetamine, tetracycline and quinidine, they are producing the actions mixed with the antacid, thiazide and acetazolamide, so they will produce the increased passive reabsorption of basic drugs, so it will produce the reabsorption that will also produce the toxic effect to the kidney and they will producing the increased risk of toxicity. Then changes in the renal blood flow, changes will produce renal flow, blood flow with the combination of non-steroidal anti-inflammatory and lithium bicarbonate. Lithium bicarbonate is a type of ions are mixed with the non-steroidal anti-inflammatory drugs, so that will produce decreased renal clearance of lithium, risk of toxicity. Decreased renal clearance means what, they are not going to exit from the kidney and they deposit into the kidney or blood into the kidney flow, so that will be produced due to the combination of your drugs. So lithium is the ions, carbon is also calcium, magnesium, ferrous, this type of ions are there. So activity or capability of these ions is what, is mixed with another drugs, so that's why this drug cannot able to excrete from the renal, so that always will always be a problem in terms of ions, in terms of absorption as well as your excretion. Then pharmacodynamic interactions, interaction in which activity of the object drug at its site of action is altered by the precipitant. This may be direct pharmacodynamic interaction or indirect pharmacodynamic interaction, means effect of the drug, how it will change. Direct pharmacodynamic interaction, direct means direct mixed with the drug. Interactions where drugs having similar or opposing pharmacological effect are concurrently, this leads to antagonism, means what, two opposite drugs if are taken, they are known as the direct pharmacodynamic interaction, known as a pharmacodynamic action, that is antagonism. Drugs have the opposite action like acetylcholine and noradrenaline, that is very famous drugs are there, acetylcholine and noradrenaline will opposite action onto the heart and other parts of your body. Addition or summation means what, it increases the action of one drug by the another drug. Drugs have similar actions and resultant effect is the sum of individual drug responses. For example, CNS depressant like sedative hypnotics are there which can increase the activity. Then synergism or potentiation enhances of action of one drug by another drug. Alcohol enhances the analgesic effect of aspirin. If you are taking aspirin and alcohol, effect of aspirin is definitely increased multiple fold. Indirect pharmacodynamic interactions. Interaction in which both the object and the precipitant drugs have unrelated effect, but rather latter somehow alter the effect of former. Actually, both are the unrelated, but sometimes they will produce the actions. That is example, salicylates decrease the ability of platelet to aggregate, thus impairing the hemostasis of warfarin, inducing the bleeding occurs. Means salicylates, it is antiplatelet drug which is having the effect, and so that's why it will increase the effect of what, warfarin. So that's why there is a chances of bleeding will be increased. Ultimate consequence of drug interaction may be known as a major life threatening. Life threatening means death may be occur. Minor deterioration of patient status. Very low, mild interaction is there, and moderate is very little effect. They can be easily overcome. Reducing the effect of drug interaction. How can we reduce? It is reduced by the additive of patient risk factor. As we said earlier, risk factor should be no. Risk factor means allergic. Which type of allergy is going to take by the patient? Means patient have the which type of drug? Aspirin, ibuprofen. Which type of the drug patient have the allergy? If this allergy is there, the doctor should not prescribe the drug, and we can overcome the risk of the patient. Take patient thorough drug history is there. Keeping knowledge of the drug being used, how much drug is there. Avoid therapeutic regimen when possible. Different types of other different prescriptions should be avoided. Only one prescription should be taken, and only one doctor should prescribe. Then educate the patients. We should educate the patient about the drugs. Then minor monitor the therapy. Monitor therapy is if after taking the drug, what are the symptoms are produced by the patient. That is why the monitor the therapy. And individualized therapy. Particular therapy should be specific, not the common therapy. Individual means specific patient specific therapy should be there. That is the completion of the third part of the drug interaction.